Hello everyone, this is Abram Solomon, PGY1 Internal Medicine Program at Eisenhower Medical Center. So let's dive in. Today I would like to talk with you about one of the fascinating immunotherapies that we have, which is Nivolumab. Nivolumab is actually a human immunoglobulin G4 monoclonal antibody, which targets programmed cell death 1 receptor, or PD-1 receptor. This receptor is part of PD-L1 pathway, which is one of the inhibitory pathways that decreases the tumor-specific T cells. Also, this receptor plays a vital role in the self-tolerance system, so targeting these receptors would prevent tumor cells from using this pathway to escape the immune response. In other words, some tumors start to express PD-1 or PD-L1 receptor, which activate this inhibitory pathway, leading to suppression of T cells that could attack and kill these tumor cells. So Nivolumab would prevent this from happening by binding to these receptors expressed on the tumor cells, allowing T cell response to survive and act against these tumor cells. But in the meantime, it will allow other T cells like autoreactive cells to survive, which might target certain organs like thyroid and pancreas. That's what actually happened with our patient, who is 75-year-old male with history of type 2 diabetes and anorectal carcinoma, who came into the ER with nausea and vomiting and diarrhea, weakness and abdominal pain. The workup in the ER showed that he was in DKA with blood glucose close to 700 and an iron gap of 35. On further questioning, he was found that his blood glucose was well controlled till 6 weeks ago before he started Nivolumab. And actually, he was found about 6 weeks ago to have thyroiditis as well, which most probably related to the Nivolumab as well. What's really interesting is that he was found to be positive for anti-glutamic acid decarboxylic 65 antibody, which is usually found in patients with type 1 diabetes mellitus. So we also wanted to confirm our suspicion by a scoring system called the Naranjo monogram, which is actually 10 questions scored differently, and it's used to give a probability of the relation between the side effect and the specific medication. And in our case, we had a score of 6, which means that it's probably related. So at the end, I wanted to say that these effects are rare, but a study of 27 patients who had type 1 diabetes mellitus related to the immunotherapy, about 75% of them had HLA-DR4, and none of them had the protective allele HLA-A2. So this could be used to know which patient is not a good candidate for this immunotherapy, and this way we could avoid such a devastating side effect.